Hello everyone, welcome to the channel Microbial World. In this video, we will be learning about the microorganism Pseudomonas aeruginosa. Pseudomonas aeruginosa is a gram-negative rod-shaped bacterium. It is aerobic, motile with a polar flagellum and non-spore forming. Now what is making it unique? It produces a blue-green pigment called pyocyanin and a fluorescent yellow-green pigment called pyoverdin. It has a fruity grape-like smell and also produces a slime layer in biofilms. Cultural characteristics. Pseudomonas aeruginosa is an aerobe, but it can grow anaerobically when nitrate is available. This means it uses nitrate instead of oxygen as an alternative electron acceptor in the absence of oxygen. The temperature range of Pseudomonas aeruginosa is 25 to 42 degrees Celsius, with optimum being 37 degrees Celsius. On nutrient agar medium, it produces a blue-green pigment called pyocyanin. And on Muller-Hinton agar medium, it may produce pyocyanin and sometimes it also produces fluorescent yellow-green pigment called pyoverdin. On McConkey agar, colorless or pale-colored colonies are formed because Pseudomonas aeruginosa is a non-lactose fermenter. On blood agar, greyish or greenish-colored colonies are formed. The colonies often shows beta hemolysis, that is, clear complete lysis of red blood cells around the colonies. Virulence factors. So Pseudomonas aeruginosa is an opportunistic pathogen and it causes diseases mostly in people who have weakened immune system. It has several virulence factors that helps it to invade the host, cause damage and resist the immune system. Let us see which are these virulence factors. Exotoxin A. It inhibits protein synthesis by inactivating elongation factor 2. Thereby, it causes cell death and tissue damage. Pyocyanin, as we already said, is a blue-green pigment produced by Pseudomonas aeruginosa. It produces reactive oxygen species and damages the host tissues. It also helps in suppressing immune cells like neutrophils. Pyoverdin or pyocyanin. These are siderophores secreted by the bacteria to steal iron from the host, which is essential for the growth of bacteria. Elastase or proteases breaks down proteins like elastin, collagen and immunoglobulin. Thereby, it helps the bacteria to invade deeper tissues and evade immune responses. Exoenzymes S, T, U and Y are virulence factors produced by Pseudomonas aeruginosa through a specialized system called type 3 secretion system. This system works like a molecular syringe to inject toxins directly into host cells. It disrupts cell signaling, damages the cytoskeleton and kills immune cells. Lipopolysaccharide is a virulence factor found in the outer membrane of the bacteria. It causes inflammation, fever and shock. It also protects the bacteria from host defenses. Alginate. It is a polysaccharide produced by Pseudomonas aeruginosa. It helps to form a slimy protective biofilm around the bacteria. It is seen especially in the lungs of cystic fibrosis patients. It also protects the bacteria from antibiotics. Efflux pumps out antibiotics and toxins. It also contributes to multi-drug resistance. Flagella and pili helps with motility and attachment to surfaces and host cells. It is very important for colonization and invasion. Now let us look into the common infections caused by Pseudomonas aeruginosa. Respiratory tract infections, ventilator-associated pneumonia and chronic lung infections in cystic fibrosis. Ventilator-associated pneumonia is seen in ICU patients on mechanical ventilators. The bacteria colonize the endotracheal tube and reach the lungs. It is a life-threatening disease and it causes symptoms like fever, cough, difficulty in breathing and purulent sputum. In case of cystic fibrosis, the bacteria forms biofilms in the lungs. It causes chronic inflammation and progressive lung damage. It is hard to treat due to antibiotic resistance. Urinary tract infections is common in patients with indwelling urinary catheters. The bacteria ascend through the catheters to infect the bladder or kidneys. It causes symptoms like burning urination, fever, and lower abdominal pain. Wound and burn infections. Pseudomonas aeruginosa is highly invasive in burn wounds. It produces a blue-green pus due to pyocyanin pigment. It delays healing and spreads to the blood and causes sepsis. Skin and soft tissue infections. Hot tub folliculitis. This is a skin infection of the hair follicles. It causes itchy red bumps after using hot tubs. Green nail syndrome causes discoloration of the nail due to pigment production. Otitis externa or swimmer's ear. This is an infection of the outer ear canal often seen after swimming. It causes symptoms like pain, redness, discharge, and itching. Eye infections are seen in contact lens users. It causes keratitis, which is corneal infection, or endophthalmitis, that is severe internal eye infection. It can cause vision loss if it is untreated. Bacteremia and sepsis. The bacteria can enter the bloodstream from other infected sites. It can cause sepsis, which is a potentially fatal condition. This risk is higher in immunocompromised patients. Laboratory diagnosis of Pseudomonas aeruginosa. Specimen collection. The specimen collection depends upon the site of infection. Sputum is collected in case of respiratory infections. Wound swabs or pus for burn or wound infections. Urine for urinary tract infections. Blood in case of septicemia, and ear swab is done for otitis externa. Upon gram staining, Pseudomonas aeruginosa appears as gram-negative bacilli, that is, pink or red-colored rods. It is often seen singly or in pairs. Culture. As we have already seen, Pseudomonas aeruginosa grows well on media like nutrient agar, blood agar, and McConkey agar. Cetrimide agar is a selective media for Pseudomonas aeruginosa. The colonies appear as large, flat, and irregular. Biochemical reactions. Pseudomonas aeruginosa is oxidase positive, catalase positive, citrate utilization positive. It also has the ability to reduce nitrate to nitrogen gas. Treatment. Treating Pseudomonas is difficult because it is naturally resistant to many antibiotics. Common drugs used include piperacillin tazobactam, cefepime, carbapenems, fluoroquinolones such as ciprofloxacin, and aminoglycosides such as gentamicin and tobramycin. So that is all about Pseudomonas aeruginosa, a blue-green hospital-loving bug that is hard to kill and easy to spread. If you found this helpful, give a thumbs up, do subscribe, and let me know what microbe we should tackle next. Thanks for watching.